She is InspireHealth physician and the director of clinical services since 2013. Hannah was raised and medically trained in Nova Scotia. A matter of fact, I trained in Newfoundland, so we were neighbors at some point. After years of working as a full service family doctor in Vancouver, Hannah was thrilled to join InspireHealth Supportive Cancer Care team. And with that, she's going to speak to how InspireHealth helps cancer patients and how clinic improves quality of life and well-being through programs and services that support the mind, body, and spirit. Hannah, floor is yours.
Thank you so much. What a pleasure to be here with all of you today, and I was very excited to have the invitation to speak to you. So as was mentioned, I'm a medical doctor and the director of clinical services at InspireHealth, which is a supportive cancer care organization in British Columbia, a nonprofit partially funded by the Ministry of Health here in British Columbia. And I'm here to speak about the importance when we look at cancer care of integrative thinking and integrative medicine and the substantial impact it can have on both individual and societal health with regards to cancer and cancer outcomes. So I'm now going to share my slides. So firstly, I'll just speak about the significant impact that cancer has. So the Canadian Cancer Society produces statistics, and from that, it's estimated that nearly 1 in 2 Canadians will be diagnosed with cancer in their lifetime, which is very significant. And it is the leading single leading cause of death in Canada. And we have made huge strides in improving survival in cancer care. So we know that if a person is diagnosed today with cancer in Canada, depending on the cancer, but the average, if you take all cancers across the board, the average 5-year survival is 60%, which has increased substantially over the years due to improvements in treatments. And so from that, we know that many people are living much longer with cancer. And for many people, cancer is a chronic disease that they're living with over many years. And so another reason why integrative medicine is so very important. And we know that cancer screening, which when you have higher rates of cancer screening, you have earlier diagnoses and you have better outcomes in cancer. So when we look at rates of cancer screening across the country, we do see that there are lower and in some cases significantly lower rates of cancer screening that are happening in certain populations. And this comes through in the research looking at South Asian populations. And there's reasons for this that we don't have time to get into today. But one of the things that this opportunity that we have here is looking at how can we address this and how can we do that in a culturally sensitive, appropriate way. So more to come on that, I'm sure. But when we also look at use of supportive cancer services, so in the case of InspireHealth, we see that South Asian populations are substantially underrepresented in our population. So another opportunity for us going forward. And one of the compelling reasons why this model might very much appeal is that there's a lot of integration or alignment with values around health and well-being in this connection. So I'm going to introduce a supportive cancer care model, and our approach to cancer care at InspireHealth, but certainly the approach that we're seeing more and more broadly across the country is this integrative, what we often refer to as whole person approach, where we're really looking at the person at the center of that, that care model, recognizing the importance of the role that, you know, some of those cancer targeted, and the C in this model is cancer, the cancer targeted treatments such as systemic therapy, you know, chemotherapy, radiation, surgery, and integrating that with all of these other aspects of health and well-being, lifestyle approaches that make a difference. So for example, we know that if somebody's able to keep active while they're going through chemotherapy, so you know, if they're able to move their body in ways that work for them, that they have lower rates of chemotherapy side effects, and they have improved ability to, tolerate that chemotherapy throughout the course of their treatment. So really, this can make a substantial difference. And we know that everybody's different. So, you know, some people are going to want to focus on that exercise. For other people, it's going to be about stress management, maybe starting a meditation practice that hasn't been a habit for them before, but really looking at that person, that individual priorities and goals, and really integrating that with a supportive approach for them that makes a significant impact. And we use the evidence in this area to inform, programs and services that are offered through this model. And we know this makes a substantial difference. So more and more we're seeing in the literature that when integrative lifestyle therapies are employed, are utilized, people feel better. Their quality of life improves. And I'm not going to read off everything that you see here on the slide, but really, really important things like decreased fatigue, decreased hospitalizations, decreased pain, improved mental health, so decreased depression, decreased anxiety, decreased cancer recurrence rates. So some really, substantial cancer related outcomes too. Improved immune function, sleep, and very importantly, this chemotherapy completion rate. So people getting to the end of their chemotherapy, and even cancer survival increases. So things like yoga, like other physical exercise, like meditation is, these are the therapies that are being studied here. And we know that integrative care empowers patients. So patients who feel well supported, they've got a team of health professionals, the conversations are going both ways between their health professionals. They feel that they can be guided and supported to make their best healthcare decisions. From that empowered stance, people are better able to manage their health. They're better able to support their mental health. Their acute care needs are often reduced because they, given that increased awareness and increased self-management, they're now managing things at an earlier stage. So that acute need is they're managing it earlier, and they're not needing that acute care support or less of it. And importantly, they feel more satisfied with the healthcare that they're receiving, with their healthcare providers, and there's overall a more empowered, positive stance across the board. And this model really supports patient choice as well, because now the person in charge is this empowered person. And so what have we seen during COVID? And Dr. Pawa mentioned, how we've seen increases in mental health, in anxiety and depression. We've seen increases in isolation. I mean, cancer and illnesses such as cancer can be isolating during normal times, but then particularly during this last year. So we've seen a significant increase in people reaching out for services. All of our services have been either over the telephone or online in the past year, but the substantial increase in the amount of engagements that we've seen, we've more than doubled. We had 34,000 engagements at InspireHealth during the first year of the pandemic, and an increase in people accessing our services also from rural and remote areas. So we know that COVID has had substantial impacts on cancer. People had delayed diagnoses, their treatments were delayed. And these are one of the reasons why we think people were reaching out for more support that was potentially missing for them, some gaps in care that COVID worsened for them. So lastly, I just wanted to say that, you know, this is hopefully some food for thought around integrative care in the cancer realm. And we are here at InspireHealth for people who are in Canada with free services for both people with a diagnosis of cancer and their families, both individual support and group support. And I did put up my the contact information there as well. And I will stop sharing now. I know this is being recorded, so I welcome any questions.
Thank you, Hannah. A great presentation. Yeah, very informative. And we have a question. I'm going to call upon Avatar Dhaliwal to ask your question, because I'm not quite sure if I could ask it and do it justice, because yeah. So Avatar, if you wouldn't mind coming off of mute.
Hey, can you hear me?
Yes.
Okay. What I was looking for is inflammation, how that can be prevented. Some bullets on that for lifestyle take up for as you age.
Mm-hmm. How decreases in inflammation can make a difference? Is that
yes?
Yes, indeed. Well, that's one of the reasons why this was very well laid out today, because, you know, if we think about Dr. Pawa's talk just now, which I hope you were here for, and she spoke about that importance of inflammation and how chronic inflammation is, you know, one of the causes of, or one of the potential influencers of many chronic diseases, and cancer is in that group as well. So we know that there is lots of connection between inflammation levels and cancer. And so absolutely, you know, when we think about ways to decrease inflammation, like diet choices that improve your digestion, and so that, you know, your digestion is running smoothly, physical exercise to you know, keep your immune system and your inflammation levels lower, stress reduction, meditation. So all of these things work to decrease inflammation in the body, and therefore, you know, it's connected with many chronic diseases, including cancer. It's a great connection point.
Thank you for sharing the measures.
And we have another question. With South Asians being diagnosed oftentimes later in the cancer disease process, are you finding that these types of interventions are having the same impact when people are diagnosed later?
Great question. So I was looking into some research this week, actually, for another presentation I was preparing. And yes, they are seeing more and more, well, they're examining this more and more, thankfully. Research is building in this area, and they're looking, the particular study I was looking at an intervention, a mindfulness intervention in advanced cancer. So these are people who were, you know, many of them were, you know, bed bound at that point in their life, and they were seeing improvements in things like digestion, and in, you know, the ability to sleep and get that restorative sleep, which can make such a difference. So yes, indeed, there's building evidence that this makes a difference across the trajectory of cancer, even with some later diagnoses or some later stages of cancer. Mm-hmm.
Thank you. We are at time. So Reza, I will pass it back to you. Thank you very much, Dr. Nette.
Thank you so much.
Thank you, Hannah, for a very informative presentation. As a surgical pathologist, I'm in Cancer Care Circle, and quite relate to your presentation. Thank you.